Hello everyone, I'm Jared Paulo F. Villanueva, an MSHI student from University of the Philippines, Manila, and today I will be discussing about ICPC or International Classifications of Primary Care. Let's talk about our objectives. At the end of the discussion, we should be able to define the ICPC, discuss the elements of ICPC, discuss the history of ICPC, discuss the difference between ICPC from ICD-10, define and discuss the episode of care, describe the structures and code structures of ICPC. What is ICPC? It is also known as International Classification of Primary Care. This classifies patients' data and clinical activity in the domains of general or family practice and primary care, taking into account the frequency distribution of problems seen in these domains. There are three elements of ICPC. These are reasons for encounter, which is considered as the true primary concept, diagnosis, which gives name to the episode of care, and process, which is the interventions that occur. Let us talk about the authorities. ICPC is produced by the World Organization of National Colleges, Academies, and Academic Associates of General Practitioners or Family Physicians. It is now known as the World Organizations of Family Doctors, WONCA. ICPC is maintained and updated by the International Classification Committee of WONCA or WICC. WICC or WONCA International Classification Committee is the longest-serving committee for the ICPC. Its goal is to develop and maintain classifications that accommodate the complete domain of a family medicine or general practice. Let us now talk about the history of ICPC. Since 1978, WHO is trying to create and prepare a classification representing patients' demand for care. This seemed important for healthcare planning as an addition to the data collected with ICD reflecting objective patient's need from a medical perspective. In 1984, WHO finally agreed to the title of International Classification of Primary Care. And in 1987, the first edition of ICPC was published by Oxford University Press. There are no foreword from the WHO, but it has a historical phrase from Kerr White of the Rockefeller Foundation. They tried to map ICPC and ICD-9, but they failed. Let's talk about the history versions of ICPC. ICPC-1 or ICPC is published in 1987, while ICPCE is published in 1993. This is also called the International Classification of Primary Care in the European Community with a multi-language layer. After 5 years, ICPC-2 was released and published, and in year 2000, ICPC-2E is published and it is the revised and electronic version of the classification. Let us talk about ICPC and ICD-10. ICPC and ICD-10 is created to code data about patient diagnosis. ICPC only includes more common diagnoses, while in the ICD, it includes wide range of diagnoses and provides finer granularity for patient diagnosis. ICPC departed from the traditional ICD chapter format. ICPC chapters are all based on body systems and follows the principle that localization has precedence over etiology, while in ICD-10, body system chapters vary from etiology. ICPC has 1,404 terms, while in ICD-10, there are 14,000 terms, which adds a clinical specificity to ICPC. Let's talk about ICPC structure. It is a biaxial structure which is divided into 17 chapters and 7 components. Let's talk about the first axis of ICPC. There are 17 chapters and these are based on body systems with additional chapter for psychological problems and one for social problems. The first axis of ICPC is identified by a single alpha code, which is the first character of all rubrics belonging in the chapter. For A, it is for general, B, for blood or blood-forming organs, which are the spleen and bone marrow, D, for digestive, F for eye or focal, H for ear or hearing, K for circulatory, L for musculoskeletal or locomotion, N for neurological, P for psychological, R for respiratory, S for skin, T for metabolic, endocrine and nutrition, U for urinary, W for pregnancy and family planning, which are all for women, X for female genital or X chromosome, Y for male genital or Y chromosome, and Z for soap. For the second axis of ICPC, it is divided into 7 components, and it's identified by a range of 2-digit numeric codes which are not always uniform across chapters. So here are the 7 components. First, symptoms and complaints. 2, diagnostic and screening and prevention. 3, treatment, procedures, medication. 4, test results. 5, administrative. 6, other or others. 7, for diagnostic and diseases. This is a conceptual grid of ICPC. Let's talk about code structures of ICPC. First part is alpha code. It is a letter in an uppercase format, and these are for the body system, psychological, and social problem. And for the second part are numbers between 01 to 99, and these are divided in 3 categories: 01 to 29 for patient wording, 30 to 69 for process, 70 to 99 for defined diseases. This is a more specific presentation of the 7 components. First is the symptoms and complaints, which are 1 to 29. Second is diagnostic and preventive procedures, 30 to 49. Treatment procedures or medication, 50 to 59. Test results, 60 to 61. Administrative, 62. Referral and other reasons for encounter, 63 to 69. And for the last, diseases, 70 to 99. Let's talk about episode of care. Episode of care is the health problem from its first presentation to a healthcare provider until the last encounter for it. It is also a defined period of illness that has a definite start and end date. It is also considered as the core concept of ICPC. Here are the core elements of ICPC or the episode of care. Reasons for encounter, health problems or diagnosis, process of care or intervention. Let's discuss another key term for the episode of care. It is encounter. It is the professional interchange between patient and family practitioner. It is characterized by the 3 elements of ICPC. There are 2 structures for encounter, which is the basic and new structure. Another key term for episode of care is episode. This consists of 1 or more encounters. Another is transitions, which are changes in relations over time. Here's an example of episode of care. There are different uses of ICPC. These are coding reasons for encounter, coding health problems, and coding process of care. Let's talk about coding reasons for encounter. It should be understood by the patient. It should be agreed upon by the patient and healthcare provider. It should be recognized by patient as an acceptable description. The ICPC rubric chosen should be as close as possible to the original statement of the reason given by the patient. Must represent a minimal or no transformation by the provider. The inclusion criteria listed for rubrics for use in recording health problems or diagnosis should not be used since the RFE is documenting the patient's view only and based entirely on the patient's statement. Here are some examples for coding reasons for encounter. For symptoms or complaints, headache or fear of cancer. For known diseases, flu or diabetes. For requests for preventive or diagnostic services, BP check or ECG. Request for treatment, repeat prescription to get test results. Administrative for medical certificate. Let's talk about coding health problems in general. Users are encouraged to record the full spectrum of problems managed. Recording should be at the highest level of diagnostic refinement at which the user feels confident and which meets the inclusion criteria. In ICPC, localization within a body system takes precedence over etiology. Let's talk about coding health problems and specific criteria. It should be coded to the highest level of specificity. Inclusion criteria should contain the minimum number of criteria necessary to permit coding with that rubric. Consult the criteria after diagnosis has been reached and do not use them as guidelines to diagnosis. If the criteria are not fulfilled, consider less specific rubrics suggested by the term consider. For those rubrics without inclusion criteria, consult the list of inclusion terms in the rubric and take into account any exclusion term. Examples are measles for A721, A for general, lump breast for female, X19 or X for female, cancer of the breast for female, X76, again X for female, marital problems, Z12, Z for social. ICPC can classify interventions in the process of care using these components. Component number 2, diagnostic, screening, and preventive. 3, for medication, treatment, and procedures. 5, for administrative. Other part of 6, for referrals to healthcare professionals, medical professionals, and others. These are negative 66, negative 67, and negative 68. But do not use the following components. 4 for test results, and other parts of 6 for other reasons for encounter, which are negative 63, negative 64, negative 65, and process rubrics are broad and general. For example, cardiovascular blood tests for K34 may encompass enzymes, lipids, or electrolytes. IC process PC codes exist to add specificity to a fourth or fifth digit. Examples given are diagnostic endoscopy negative 40, diagnostic endoscopy of the digestive system negative D40, gastroscopy for negative D40.1. Partial examination or negative 31 refers to a partial examination directed to a specific organ system or function. Example given is blood pressure check or negative K31. Complete examination or negative 30 refers to an examination which is defined by consensus of a group of local professionals to reflect the usual standard of care. Example given is complete neurological examination or negative N30. The following are to be coded as negative 30 or negative 31. Inspection, palpation, percussion, auscultation, visual acuity and fundoscopy, otoscopy, vibration sense, vestibular function, digital rectal and vaginal examination, vaginal speculum examination, blood pressure recording, indirect laryngoscopy, height or weight, and other examinations are to be included in other rubrics. For Component 2, Diagnostic, Preventive, and Screening. This includes immunization, screening, education, and counseling. For Component 3, Medications, Treatments, and Procedure do not include immunizations. For Component 4, Test Results do not include process or interventions. For Component 5, Administrative or paperwork. Here are some examples. Negative R50 for prescription rhinitis, negative H51 for removal of earwax, negative P45 for discussion marital problems, and negative 66.1 for refer nurse. Here's an example of ICPC2 rubric. Here are the sources of this presentation.